Good afternoon, everyone, and thank you for joining us on the news briefing for this Wednesday. Our County Department of Environmental Health continues to keep the community updated on work that is being done in the wake of the Moss Landing power plant fire. We're very pleased to have Rick Encarnacion here with us from Environmental Health. He's the Director of Environmental Health, and he's going to provide an update for us. Rick, thanks very much for being here.
Thank you, Maya. Rick Encarnacion, and good afternoon, everybody. Rick Encarnacion, Director of Environmental Health, County of Monterey. I'd like to let the public know that we're continuing to coordinate with our state partners, the Cal EPA, the Department of Toxic Substance Control, DTSC, the Office of Environmental Health Hazard Assessment, or also known as OEHA, California Department of Public Health, CDPH, and Cal Recycle. All of these partners and others are helping us determine the impacts to the environment. They're also helping us alongside with the enforcement aspect, along with the US EPA. Just again to emphasize, our local role here in the Environmental Health Bureau is to ensure proper cleanup, as well as actions taken by the responsible party. And while we're trying to determine the how far and wide the environmental impact is. So we want the public to know to stay informed with the official reports from your local government as we continue these efforts. And with that, if there's any questions.
Thank you very much, Rick, for that broad overview. And we want to give people a chance to put some questions in chat. But one thing that came out on Monday night was some preliminary results. And I wonder if you could talk, we had data and then we had preliminary results. There was a little lag time. So the community was wondering, when would they get these results and what it might mean to them. Could you talk a little bit more about, their sampling and then they have to be analyzed, and that there is some time that is needed to get those meaningful results to the community?
Yes, thank you very much for that question. What we're trying to do is balance the transparency. We want the public to know what we know, as well as what we don't know, and what we're doing to try to find out the scope and breadth of the situation. When we released the screening results, we had the caveat for the public to know that these are screening results. They're not to be taken as final results or a final conclusion. There's much more that needs to be done. There's much more that needs to be coordinated. We have to be very diligent in making our conclusions. As I've mentioned, this is regulatory related, as well as a health concern. With regards to a timeline, our partners at the Office of Environmental Health Hazard Assessment, which are staffed with toxicologists who can help interpret the results, are working for us. They're working with us to provide that accurate information so that we could inform the public. It may take, I'm hoping not too long. I can't speak for, and I'm not a toxicologist. I can tell you that the situation obviously is of a large scale. There's complexities involved. And the update, I can say, kind of confirms what we observed in the field. An affected area would be obviously the one that is closer in the direction of the wind, would be the ones that we would, and where you've obviously observed fire and ash debris. Kind of confirms that observation. So with that, that's not to say that we're done testing and that we're only looking in the direction of the wind. We're also looking in the surrounding communities to make a full assessment and to also address the concerns of all the community. So with that, the public again should be rest assured that we're still providing services. We're not done, and we're cooperating with our partners, and we're listening to the community. So more testing, more results to come out. Be vigilant, be alert, and listen to official reports.
And thank you for mentioning the part about additional testing, because that is just one question that I did get is, are there plans for more testing? And you just, you answered that, but at this point, you can't tell people exactly where you may be testing. So I think, people are looking at the map and they're wondering, what the next steps are. And I think what you're saying is, we'll keep you informed about these next steps.
We'll keep the public informed. We'll also include the public in getting feedback, because the public are the ones are an additional eyes and ears for us. We're the eyes and ears of the public, and so is the public is the eyes and ears for us here in environmental health. And in terms of additional testing, yes, to draw a good conclusion, but even ongoing, just to explain what we do here in environmental health, we're always conducting inspections and routine overview of many businesses, Vistra and PG&E notwithstanding. We're always providing oversight inspections for water systems, wastewater systems. Many people know we do the restaurants, swimming pools, gas stations. We're part of the hazardous materials incident response team. And an incident like this, although large in scale, is not new to us in terms of responding to chemical spills and releases. So in general, after the emergency is done and the fire is out, environmental health picks up to try to determine the environmental impact and then direct responsible parties to take action. And in some cases, that may be within a week. In other cases, it may be months. In bigger cases, it may take longer than that. And I'm expecting this to take longer. So again, the public needs to be vigilant and aware of our official reports as they come out. We're balancing transparency with respecting the enforcement process, security, and privacy. So with that, I think the public should know in terms of a timeline, they should know that we're always there. And I expect my team to continue on with testing and monitoring.
Thank you, Rick. And I've got some questions coming in and I'm going to start with them. But this first one may be more of a public health question. I'm going to ask it and see if there's anything you can provide. I'm not sure if we may have someone from public health who may be able to answer this, but I'll go ahead and ask it. Residents who have side effects they believe could be from smoke exposure are saying that they feel that they are on their own in terms of figuring out what tests they need to receive and what they should tell their doctor. Will the county give them any guidance?
I totally understand that the concerns of the public when they, with respects to concern and fear. If any case, people should always seek medical attention if they feel they need to see their doctor. And with what the county will provide, I can, at least for environmental health, the Environmental Health Bureau, which is part of the health department, I will ensure that I will fulfill my responsibility with regards to ensuring and enforcing of proper cleanup and follow-up actions by the responsible party. So that's within the scope of environmental health. I don't know if I can directly speak to the other issue.
I think in terms of public health guidance, and I see Karen Smith may be on, and I'm hoping that she will correct me if I'm wrong, but we recommended to people who did feel effects to go see their doctor or go see a doctor and describe their symptoms. And I believe that in results that were released on Monday night, we recommended people avoid any ash or debris that they may encounter for now until there was additional testing. Karen, did I touch on all the points?
Yeah, we always encourage people who feel like they're ill and they need to see their provider to go see their provider. And in terms of giving them information, I would suggest letting your provider know that you feel you've been exposed or that you are in the plume area. But it's not reportable to public health. So that will change over time.
Well, and you mentioned it's not reportable, but you have said that the health department, but public health is tapping into doctors and asking what are they
Yeah.
hearing from people?
So we do what's called syndromic surveillance, and it's a tool that public health uses to kind of get a situational awareness of who's coming to emergency rooms and what their chief complaints are. So they set up a surveillance template for this, and looked at the typical respiratory illnesses that we would see coming through. It did not rise. What the reports that I saw is it did not rise. And it was what we expected to see this time of year. More will come as the data comes in and we're able to look at it more closely.
Thank you, Karen. And then the next question is for you, Rick. If the county comes across heavy metals or toxins while testing, does that area get closed off?
Sure, that's a very great question. As I mentioned here in environmental health, the work that we do in response, what we're doing here with the Vistra power plant fire is similar in many ways of what we do here in environmental health every day when we respond to fires, like a restaurant fire, a sewage spill, when there's a sewage spill that leads to the ocean. We take proper measures, and if we need to secure the area to protect the public, and while cleanup is being done, it's done. In this case with the Vistra fire, the battery plant fire, there was a call to evacuate because of the obvious hazards related to this profound amount of fire and smoke, an immediate issue with inhalation. So in the aftermath of the fire, what we're trying to do is try to determine what we can't visually see. We have to do soil testing. And then with that, if there are levels that would require, and I'm not just talking about heavy metals. In any case, if we come across levels that would require securing the area, that would come immediately. In this case, we're conducting our testing, and it may be far and wide, but as we get farther from the incident, it may be a little bit more dispersed, and it may be harder to connect what we see in the field the farther away we are from the incident. But again, that's why we're working with our partners at the Office of Environmental Health Hazard Assessment so that they can interpret the findings and evaluate the findings in the field so that we can take appropriate action.
Thank you, Rick. And then I've got a series of questions for you, and we'll hit them all, and they're all from the same reporter. So if something else comes in, I'll rearrange. But here we go. How is the county taking into consideration the research that was done by San Jose State? According to the university, 3 types of heavy metals were found in the marshes near Moss Landing Marine Laboratories.
Yes. The Environmental Health Bureau, along with our partners, but primarily the Environmental Health Bureau, we're open to taking any and all information from the public. And in particular, we have Dr. Aiello from San Jose State with the Moss Landing Marine Laboratories provide his data, or his findings, I should say, or what he observed, which in terms of our enforcement activities, kind of confirms the visual observation of the closer you are to the incident, there would be impacts to the environment, just like in any fire. So with that, we will continue our efforts to conduct testing, to evaluate the situation, and direct the responsible party to take appropriate action. So how are we taking Dr. Aiello's and San Jose State University's data? We're aware of it. It confirms a visual observation of the occurrence with what we need to do in terms of enforcement. It's the Elkhorn Slough is a neighbor of Vistra, and I'm sure that there would be actions that would need to be taken to address the incident and the result. So, speaking from an enforcement and regulatory point of view, again, we take information from any party, a complaint, an observation, even a study that would help confirm our enforcement actions to move forward. So in terms of determining the how far and wide, that would be what we're doing right now, probably separate from Dr. Aiello's study. So in terms of how far and wide, that's where we are working with our state partners and toxicologists and professionals who are very adept in addressing pollution and incidents like Cal EPA, like the Department of Toxic Substance Control, Cal Recycle, OEHA, and the Department of Public Health. So I hope that answers the question, because I think the question is, how are we considering the research? I'm not a researcher, I'm not a scientist, but in terms of information, for me as a regulator, it confirms my observation. The closer you are to the fire, there was impact that needs to be cleaned up.
And I think you might also want to explain that there are some differences in what was provided where the environmental health is receiving specific data, and the findings that San Jose State is sharing is not data, they're observations, and that may be why you're looking at it in that way.
Yeah, I can't speak for San Jose State in terms of data or observations. They're on a path to make conclusions for a study that they've developed. What we're doing here in environmental health locally as a regulator, as a responder to an incident, is to make determinations of the impact because of the fire. In terms of in terms of the data, we have a process and procedure that's related to enforcement. We're not doing a research study here. We're doing this for the purposes of ensuring within the authority of the county and our partners that proper actions are taken. Okay, so I think the next question is where we can find the list of agencies we're cooperating. I think that was provided in a press release.
It is, and I will resend. I was actually thinking the same thing. When I do, after the briefing, I do a follow-up with our media partners, and I'll include the same list that we provided on Monday night, just for everyone's knowledge. And then next question, what kind of data or samples will also be collected, which you touched on just a bit, and why is the public not allowed to know the specific locations where the data is being collected?
Sure, great question. So first off, we've done and we will be doing soil and water samples. Ongoing air monitoring is going on constantly. The decision to release the soil screening results and the sample site maps, rather than specific addresses, was grounded in both privacy and security considerations. Protecting the privacy of our residents near the sampling sites is essential to prevent unnecessary concern or misinterpretation, especially when the results are still under evaluation. Additionally, sharing exact addresses could raise security issues for both our samplers and the properties involved. It's crucial, again, like I mentioned, that this is an enforcement process. There's a regulatory enforcement actions that may follow. So as a regulatory agency, it's crucial that we respect the process and while we maintain public transparency, and also, again, while we ensure the integrity of the ongoing investigation. I just want the public to know, again, in respects to this question, our ultimate goal is to balance public awareness with protecting individuals' privacy while supporting the effective regulatory actions.
Thank you for that, Rick. And next question, what environmental concerns does your department have? And could this affect tourism in this area?
Great question again for environmental health in general. The environmental impact of concerns, we're concerned with the impact that it may have to soil, water, and air. The field of environmental health, in a nutshell, is in terms of the regulatory scheme for environmental health, is to oversee businesses and individuals who may have an impact to the environment. So in this particular case, where there was a fire, which resulted in the release of chemicals, in particular, nickel, manganese, cobalt, and hydrofluoric acid during the event. And after the event, the particulate matters, nickel, manganese, cobalt. And if there's any others that we would have concern, it would be related to battery fires. So those are the environmental concerns. How would it affect soil and water? And in particular, I just also want to emphasize, this was an incident. There are other cases where there's an ongoing release of chemicals, which this is not. Even if you look at Moss Landing, you notice the two stacks there, right? The two stacks, they're not connected right now. They're just a landmark, but the purposes of those stacks were to address back in the day when there's constant emissions that had to be pushed way up into the sky in order for it to be considered operating as safe for the community during that time. So in this case, we had a fire. Fire's out. It's still being monitored for safety, and there's no continuous deposition that you would encounter like with factories or other businesses that may have constant emissions. How this could affect tourism in the area? Well, I think that would best be addressed by business and professionals, but the Environmental Health Bureau, we do play a part in ensuring the economic viability of the community that we serve. We conduct inspections in restaurants. We do inspections at public swimming pools, in big hotels and small apartment complexes. We inspect gas stations and other facilities that have chemicals to ensure that their chemicals stay intact and don't pollute the ground. All of those things could affect tourism and the economic viability of the community if not provided proper oversight and control. And in cases of accidents, proper follow-up, cleanup, and accountability. So yes, if we do not have the services locally for environmental health, yes, there would be an impact to the economy. But I want to give the public to be rest assured, we're not going away. We are a standard service for the county. You may not hear about us every day, but when the time comes for us to respond, we're always there.
Thank you, Rick. And thanks for sweeping in some of those similarities into this. Certainly a confidence builder. Another question for you, did preliminary results for the soil metal levels show any risk to public health?
Again, the information that we released is the screening level. It's screening. It's part of a process. It's part of a piece of the puzzle that we need to put together to make these statements of the impact. But when it comes to immediate hazard levels, the county has the mechanisms to address those not only in public health, but we have our fantastic Department of Emergency Management, our fire departments, our law enforcement departments to address immediate hazards. Like what we did during the fire. There was a call to evacuate. That is an immediate public health hazard. The preliminary results, this question about the soil levels, do not misconstrue what we release to the public as the final results. It is a piece of a puzzle. And we release that information so that the public could be informed that we're doing what we need to do to find out the impact to the environment. There was a great demand to release information. And, many people would be hesitant on the professional side to release pieces of information while we're putting together the puzzle. But I think in this day and age, and from what we've learned in recent years, it is important to put out information for the public and then back it up with things like this, speaking to the people who are the sources of the information to rest assured to the public that we serve that this information means we are not going away. We are completing the job. And even after this incident is over, we're still not going away. It's our job and duty to provide oversight and regulation. So if there's any risk to public health, that is an ongoing effort every day with environmental health. We want people to be informed and vigilant if there's issues of immediate hazards. It's not just environmental health that takes action. It's a whole coordinated effort in the county that you've seen exercised and executed during this event, which I would say, was pretty good. There's always room for improvement when it comes to communication and outreach during the event, but that whole scheme of our emergency response is also constantly improving and not going away.
Thank you, Rick. And then one last question, unless somebody put something in chat. Has there been any testing in ag fields and any concerns the crops near the fire site could be impacted?
Mm-hmm.
That maybe only a piece of that might be for you.
Sure. Yeah, we're definitely, like with all of our other community partners and organizations, the agricultural community definitely is a significant partner in this. So with respects to testing, it is part of the bigger piece that we're doing. I can't speak to any specific, just like what I described before, I can't speak to any specific sites. We provided the map. That's just one part of it. We're not done yet. And, that will definitely include coordinating with our industrial agricultural partners.
Thank you, Rick. And then we do want to get to our next topic. Are there any last questions for Rick before we get to our other two topics? One more for you, Rick, and this should be our last question because we're getting tight on time. Is there an estimate for when your department will begin to release more data to the public, and where will we be able to find that information?
Mm-hmm. I don't have an estimate. As soon as information becomes available, we go through the proper channels to ensure that there's no, that what we release is useful to the public. If at least it would be to inform the public, but I can give you a timeline. We're working every day on this. Every day, it is pretty much our top priority here in environmental health. So as soon as information becomes available, we could release it. And releasing that data, obviously, is just not releasing the data. There's a process where we vet the information and put it in a format that can be available to the public.
And then also on the question of where the information can be found, in the follow-up email to our media partners, I will include the link to the Moss Landing fire incident page where we have been placing that information. And if there are any changes in the location, we will also alert you about where this can all be found. And we're going to stop with Rick here, and then because we have Brad Watson, who is the Senior Director of Community Affairs with Vistra Energy. He has joined us. He is going to give us an update, hopefully maybe some information about what's happening at the site and then the programs that Vistra is launching. Hi, Brad.
Good afternoon, Mia. Hello, everyone. Again, great to be with you. Brad Watson, Senior Director of Community Affairs at Vistra. Let me, to Maya's point, start out with a little bit of an update for you at the site. As you know, we got quite a bit of rain last night through the area. The rain from our folks on the site there lasted until about 11:30 last night. And so there was a concern about what that may do with the existing batteries that are still there at the site. As you know, there are still some battery racks that are intact, and those have some state of charge in them. So what would the rain mean to that? Fortunately, there was no flare-ups, there was no reaction, no emissions, and we took some drones up earlier today at daylight, and we didn't see any problems developing. In fact, what we're seeing are the temperatures that continue to drop in the building and around those batteries that are remaining. So at this time, we're still going through a process with a structural engineer to determine how we can come up with a process that is safe to ultimately get people in there to a building that's unstable now, but how to stabilize and get people in there and then begin to remove the batteries that are remaining in there. Now, we do have two also assistance programs that we have started. Both can be found, details of both can be found on mosslandingresponse.com. That is Vistra's information page to the fire, mosslandingresponse.com. One is the business assistance program. So let me start with that because that's the one that was announced just the latest a few days ago over the weekend. And it's up on our website there. We've had a pretty good response. We're looking really at mostly the businesses that were in the evacuation zones, those most likely to potentially incur some kind of financial impact as a result of the fire in the evacuation zone, roads and highways being closed. Outside of the zone, claims for businesses outside the evacuation zone, they may also be submitted and may be eligible for the program, but all of them ultimately have to show that the losses they have were clearly demonstrated to be directly tied to the event. So we've had a pretty good response so far of businesses in the evacuation zone who are coming forward for financial assistance. I'd say so far we have, about 20 claims or so. And some of the activities actually happening in real time for those businesses who wanted to meet with a claims adjuster. We're making that opportunity available today. And so there are folks who are meeting in person with the third-party claims adjustment firm that Vistra has brought on to process these kinds of applications. The second one was the program that was to assist residents who were impacted by the evacuation. And we have had, I think, a very good response with that. We, again, want to thank the Community Foundation of Monterey County and its partners, United Way, and the Castro Plaza Family Resource Center for assisting to make these cards available, go through the process by which households that were in the evacuation zone could apply for these gift cards and then come collect the cards at two events. We had one over the weekend, and then we had one on Monday. We had a good response. And we are looking at having, because we have a few additional households that were made aware of the event over the weekend and Monday. They may have been impacted also because there were some households we learned that were just on the periphery of the evacuation zones where sheriff's deputies either asked those residents to leave or perhaps they didn't let them back in because of transportation and road closures. So we're going to look at those as well. And we are planning to host another distribution event. That will be later in February, so we're going to look at that. Once details are confirmed, we'll put those details on our mosslandingresponse.com website. So I'll stop there.
Brad, thanks very much for all the information. The assistance programs sound like they're really moving along, and I think a lot of people are still really interested in, knowing what's happening on the site. But of course, nobody but drones really are going in to really understand what's happening after the fire. Are there any questions for Brad regarding the information that he provided? I'm giving people a second to. Here we go. Can you tell me the date the fire was totally extinguished? And you may not have that because it may not have technically happened yet, right?
Well, I would yield to Chief Mendoza, North County Fire Protection District.
But and just for clarity, Vistra does have a fire teams on site, however, correct?
That is correct. That is correct. North County Fire has stood down from the site, although they're in consultation daily. And also, my understanding is that Chief Mendoza or staff person comes by every day. In the meantime, to free up those resources, and we thank the chief and his firefighters for all they've done, Vistra has a fire department there, or a fire brigade that we have hired, so that they are constantly monitoring the building 24/7.
Great. That's great information. Any additional questions for Brad before we let him go? Seeing if we get any additional questions for you, Brad, because we're pushing to get to our last topic, I'm going to forward them to you for a response. And again, I really appreciate you being here to share information with us.
No, happy to do it.
And then last but not least, we really wanted to make some time for this particular topic. Immigration issues are really a concern for a lot of residents in our community. And the County of Monterey wants to remind residents that our health department and Natividad Hospital both provide services for people regardless of their immigration status. We're very pleased to have Dr. Chad Harris, the CEO of Natividad, and Elsa Jimenez, the director of our Monterey County Health Department, here to talk about this topic. And Chad, I'm hoping we'll start with you.
Thank you, Mia. I appreciate it. And good afternoon, everyone. Thank you for joining us on this call today. Today, the County of Monterey's Health Department and Natividad Medical Center released a statement reaffirming our commitment to providing high-quality care for all. We are committed to providing equitable, compassionate care to all individuals, regardless of immigration status. Patient private medical information is protected. Patient privacy and trust are central to the care we provide, and we take all necessary steps to safeguard that trust. Our policies are designed to make every patient feel safe, respected, and welcomed at our facilities. Elsa?
Thank you. The health and safety of our patients remain our highest priorities. California law and the policy of the Monterey County Board of Supervisors ensure that we will continue to provide the best health care for all who need it. Dr. Harris and I appreciate the uncertainty when there is state or federal changes in administration. We want the community to understand the county health system is here for you. We urge the public to continue to access the array of services offered by the County of Monterey Health System. Immigrants are always welcome to access our services. Please keep your appointments, whether with your primary or specialty care doctor, your mental health provider, your public health nurse, your WIC nutrition services, and Natividad's emergency trauma and hospital services are here 24 hours a day. You can find resources on the Monterey County website under Know Your Rights, comry.us/Know Your Rights. Red cards with information about your constitutional rights are available at Natividad and our health department clinics.
Immigrants are a vital part of our rich and vibrant fabric and history of Monterey County. Natividad and the health department proudly serve the entire Monterey County community and are committed to always providing high-quality, compassionate care for all. We are here for you. Please continue accessing your healthcare services with us. And thank you for being on the call today and helping us share this vital information with your readers, listeners, and viewers.
Thank you both for being here just to really drive this point home. We've got a couple questions for you already in chat, and one of them is kind of more of a logistical question. Is there a reason why Natividad is making its own statement? I understand the other hospitals in our area kind of joined together for one, but why did Natividad do its own?
No, I appreciate that question, and also feel free to chime in as a partner here in the county health system. You know, at the end of the day, I think it really speaks to the dedication of how our whole community is coming together to support the community. And then as a public health system, we have a special role together in all the services that we provide. Elsa just mentioned many of them, whether it's public health nurses or WIC or mental health providers or our primary specialty care or trauma or emergency services or perinatal. The list goes on and on, but we're here to represent the arms around as the public health system, and again, really just speaks to how we're all coming together as a community, including the other hospitals and what they're doing too.
Elsa, I want to give you an opportunity if you wanted to chime in on that before the next question.
Yeah, you can go to the next question.
Have any appointments been canceled? And this isn't the first time we've heard, concern about people not wanting to go seek services that they might otherwise, feel free to seek.
Yeah, I can speak for the health department services. Fortunately, we're not seeing higher than normal no-show rates or people canceling their appointments. And so again, we encourage the public to continue to access our services. Please know that we are here to serve you and we want to help you on your wellness journey. And we can only do that if you participate in our clinics or see your therapist and some of our other specialty service providers.
And a follow-up question to the whole joint statement thing. All of our hospitals in the community made statements together during COVID. And so there was just a curiosity about why the health department and the hospital are doing this in terms of a public health system.
Again, I appreciate the question. I think it gets back to our special role as the public health system. And, there's not a necessarily specific reason that's what it comes down to.
And then another question, are the Natividad and clinic staff being trained what to do if ICE comes on property or in the facility?
Did you want to answer first, Dr. Harris?
Sure. We're messaging to folks just to remind them of process, including privacy, which hasn't changed, and if they need additional help from administration or the staff. Yes, we are messaging. Elsa, I don't know that you want to add.
Yeah, we're doing the same. We're just reminding them of the procedures that we have in place when somebody comes into the clinic seeking information on one of our patients. Reminding them that, if this were to happen with an official from ICE or another federal agency, that we follow those same protocols that have been in place and that we safeguard our patients' privacy, that we not allow individuals of the public who are not there to seek care into patient areas. And so we're just continue to remind our staff of the policies and practices that we have in place when any official of any law enforcement agency presents themselves in our facilities.
And Elsa, I understand you wanted to kind of share some information in Spanish for our viewers who may prefer to get this information in Spanish, who are maybe watching.
Yes, thank you. Just a few statements I would like to make. Queremos decirle que la salud y seguridad de nuestros pacientes sigue siendo nuestra máxima prioridad. El doctor Harris y yo entendemos la incertidumbre que puede surgir con un cambio de administración al nivel estatal o federal. Sin embargo, queremos que la comunidad comprenda que el sistema de salud del condado está aquí para ustedes. Los inmigrantes siempre son bienvenidos a acceder a nuestros servicios. Por favor, Mantenga sus citas, ya sea con su médico de atención primaria o especialista, su proveedor de salud mental, su enfermera de salud pública, servicios de nutrición en WEC y los servicios de emergencia, trauma y hospital de Natividad, que están disponibles las 24 horas del día. Las tarjetas rojas con información sobre sus derechos constitucionales están disponibles en Natividad y las clínicas del Departamento de Salud. Gracias.
Thank you, Elsa. And you did mention the red cards. And as we close, I just wanted to let people know that the red cards, which are informational cards, are available at the health department and at services and at the hospital, correct? That if people aren't sure when they're there, that those cards are available to them.
Most definitely. They're available on our service counters. They can ask for them as well with their medical assistant, their provider. Many of our public health personnel who are out in the field and making appointments in the home also have those red cards available. Our behavioral health practitioners also have those cards available. And we've also distributed, we being the county, have distributed thousands of red cards to our community-based partners and organizations so that we can ensure that our immigrants know their constitutional rights and have information readily available to them.
Thank you, Elsa. And thank you all for being here on the news briefing this week. Our next briefing is next week, and we'll see you then.
Thank you.
Thank you.